In 1955, as you know, I was put on disability by the Metropolitan Life Insurance Company because I had, following an operation, I got emphysema, and I had Parkinson's disease, and I had many problems that developed. Florence got us started on this Neolife. That was in 1970. And I didn't see it was helping me at all. And I was, they were having difficulty keeping me on it all the time because I did not see improvement. But our bodies do not build ourselves roughly like you're not eliminating the problem, you're rebuilding your body. So in 1970. In 1974, that the doctor of the Oregon Lung Association said that, well, Mr. Pearson, you're no worse this year, which was an unusual thing because it kept getting worse and worse all the time with my emphysema. And in 1975, the printout, which I still have, showed that my breathing capacity was 228% of what was expected from my past history. And in 1976, that was 6 years later, that after I'd been on Neolife, that the doctor right here in the Eugene Hospital called me after my examinations and said, Mr. Pearson, I have some good news for you. We can find no impairment in your lungs whatever, and to eliminate all medication for my emphysema. And I told him that I couldn't do that because I was off for one day. I would land in the hospital. And Lucy and I talked about it, and we decided, well, we would try it for one day. We were not too far from the hospital where we're living now. And so we did. And I got along all right. We went the second day, I got along all right. That was in 1976, and I've been on no medication for it since that particular time. I might just say the thing that really changed the whole experience that I had as far as my health was concerned was in 1970, going back to that time when or not 1971 I guess it was, when I had my last heart attack. And I landed in the hospital in Portland. And it was an Adventist hospital. I had an Adventist doctor. And when he looked over he had told my wife that he said there's no possibility of me living over 6 months, and to be sure that our legal affairs were in order, and we got an attorney, and with tears we went over our estate and what we had to do. And as a result of this, that the doctor interviewed me, and he said that now I have to know everything you're doing, everything you're eating, your exercise and such. And he told me, when I showed him my Neolife products, most doctors had said they're negative on such things, so I had never told him anything about having them. But I showed them to him, and he looked at them and he said, this is exactly what you need. And I looked at him and I laughed. And I said, what I need? I said, I've been on it now for about 4 months, and I've got another heart attack. So you must be wrong. And so he said, well, I don't know, how much are you taking? I said, I'm taking exactly like it says, 2 vitamin E's a day, 2 B's a day, 2 C's a day, and so forth, the different things I was taking. And he says, well, Mr. Pearson, our hospital beds are filled today because so much of our food is processed. And so he said, this is why you need this particular supplementation. So he sat down on my bed, and on his prescription pad, instead of me taking 2 vitamin B's a day, he put me on 3 vitamin B's a meal. Instead of 2 vitamin E's, he raised it up to 1,200 units a day. And my vitamin C, he raised that up to 2,000 milligrams a day. Then he added desiccated liver that I was not taking, and the protein and all that I was taking. He left me on the other things that I was taking at that time. It's just like an automobile. If you have to have gas in the tank, you have to have oil in the motor, you have to have water in the radiator, air in the tires, you have to keep it started, and if anyone is missing, you're stopped. And your body is much the same. So in this program, it supplies the full needs that the body has, And it's been a real blessing to both my wife and I, and we live a different life than we did.
Well, we better start by having you introduce yourself.
Oh.
Who are you?
Oh, I'm Lucy Pearson. Don't you know Earl Pearson's wife? Yeah, he's the one that's, he's the one that is the head of our household. You know, Earl means top notch. So that's why I have him, so I don't have to talk. He does all the talking for me. But anyway, it's meant a lot to me because, well, at 85, and me an arthritic, I don't mean arthritic, diabetic. Why, you know that I wouldn't be around here now if it wasn't for Neolife. And I'm enjoying myself. I take quite a few of the products and they work for me and keep me going. And, some people say they can't swallow pills. Well, these are supplements, not just pills. And when you know how much good they're going to do you, you just take them. And I have just tried to help Earl to get what he needs, but in my investigations and everything, I found out a lot about what I need too. And of course I take all of the digestive aids because my digestion is poor. And then I take the Formula 4, of course, because that is an essential one. And I always take my protein and, what's her name? Don Lawson. He suggested, since I don't digest my proteins very well, he suggested that I take the protein in the evening as well as in the morning, which I had never done before. So now, since I take it in the evening too, well, I give it to Earl too, and I'm sure that's good for him as well. Well, let me see. Oh, yes. I always take vitamin E, some every meal, one every meal. And, it's hard for me to tell just what each one has done for me because it seems like I don't feel bad any time. I just feel pretty good and maneuver around and do the things I want to do. And I go to the Neolife meetings and enjoy them, and I learn something every time I go. So I wouldn't want to miss any. But I especially wanted to hear you, Jim. You're the doctor.
Tell me, as you look back on your experience with Neolife with Earl, do you think he'd be around now if he had not been taking the supplements?
Oh, I'm sure he wouldn't, because he'd had several heart attacks before. And
what kind of condition exactly was he in when he started?
Well, he wasn't feeling too bad, but when he got in the hospital with a heart attack, well, that always gave me a lot of concern. And so
Had he had more than one heart attack?
Yes, he's had several. And the last one, that's when the doctor told him that he needed more supplements than he was taking. And he said, well, he would take as much as he told him to. And he did. And it worked. And he's never had any heart attacks since. So we know that that's the thing that has helped him. And he also had hypoglycemia, And the doctor said he'd never get over that. But he has. He's never had it since 1976. Now, how many years has that been?
12.
12 years. Yeah, that's right. And that's something. If he wasn't over it, why, it surely would have showed up in 12 years, wouldn't it?
Did he have Parkinson's also?
Oh, yes, he had Parkinson's, and he was so humiliated with shaking and so forth. But, and he still shakes a little sometimes, and especially when he gets overtired. But he gets along just real well. I'm just amazed how well he does get along, and the way he gets out and works outside and everything. But he's not as strong as he used to be, I can tell that. He gets tired quicker, but the one thing about him, when he gets too tired, he stops and comes in and lays down on his bed and rests. And that's what I ought to do, but I don't, because I know I'd never get through if I did.
And did he have to carry an oxygen tank around?
He has had it in the trunk of the car, but he has never had to use it.
Did he have to use it years and years ago?
No.
He never had to use it?
No, excepting when he was in the hospital.
Mm-hmm.
And so that's why he got one, and the doctor said he should carry one with him, but he did never have to use it. But he's loaned it to other people several times, and they never offer to help pay for the next one. But of course they don't think anything about it. They just are happy to get the help that it gives to them.
Mm-hmm. And how old are you folks now?
Well, I'm 85. I was 85 in May, and Earl will be 85 in October. Mm-hmm.
So you're 85 and still going strong.
Well, I think we did pretty good. Our church had a work day out at our campground, Harlow Campground, just a couple weeks ago. And we both went out to work, and he took his hedge trimmers, and he trimmed a lot of shrubs. And I know how to pull weeds, so so I pulled weeds around the house. And I didn't mind doing that because I do that at home, and I knew how. So.
Great. Well, that's it.
All right.
Unless you have any other comment? You have any other comment you want to pass on to young people that are thinking about nutrition?
Oh, well, I think they should start in early and not wait until they get some disease that's tearing them down. If they just take, well, even the children, if they'd had enough vitamin A, the children wouldn't come out with glasses on at 5 years old, and some of them even younger than that. And they'd have much healthier children if the mother knew how to take her vitamins and so forth before the baby arrived. It would do wonders for her and the baby. So, and the child as he grows up. Oh, I could just boost Neolife. I know it's the best one there is, and we're so happy that we have Dr. First, because you know he is tops.